process of diabetic nephropathy progression and destruction. So, with a higher pressure, we get also an increased intraglomerular pressure. So that's the problem. Increasing the afferent, tight, it's already tight, you increase more, you increase it. You also constrict your afferent artery, you increase your glomerular pressure. So sometimes people think, well, another effect too is hyperfiltration. So people do not even realize that they have hyperfiltration because with this one, when you increase the pressure inside, you increase this one. But they don't know that actually just brief. And actually it's not good. It's actually toward destruction here. Okay? Because hyperfiltration, you actually increase the pressure thinking it's good. It's not. Because further checks, there are something going on. Okay? And that's more damage as well. And more escape of protein. Damage in the endothelium, yes. We have also damage to the glomerular filtration membrane, yes. And we have also renal hypertrophy. Not all patients will have this, but some will have an enlarged, this is a renal hypertrophy. So that's one effect of high blood pressure with diabetic nephropathy. Okay, so basing from this, we have a patient here or a person that don't want to be treated with this high blood sugar because he's diabetic and high blood pressure. So this is what's going to happen. We have a chronic kidney disease here. The chronic kidney disease here is positive for kidney damage, yes. There is a decreased level of kidney function, yes, for 3 months or more. And the ranges of this CKD or chronic kidney disease could be mild, moderate, or severe. So this will be more severe to the point that, the kidney function is quite low. That's the time that the person said, oh, there is an advanced chronic kidney disease in here. And the signs and symptoms could be swelling, fatigue, short of breath because of fluid overload, skin color because waste matters or waste materials should be discarded through urine. But because your kidneys are working, they settle. So they are pretty obvious in your skin, leg cramps, and more. And if this chronic kidney disease is not treated, we're going to have an end-stage renal disease here. So the person might pee a little bit or not at all, and that person requires dialysis. So dialysis could either be, peritoneal, or it could be hemo. That will, under the discretion of our renal doctors. Okay, so how will I know if my kidney is okay or not? First, you have to have blood works drawn. In the blood works, they will tell you your kidney function, your GFR or your estimated GFR, which is your glomerular filtration rate. So how well or how much is remaining function, how much is the remaining function of your kidney? So normal is 16 above. I will be happy if that is 16 above if I am not diabetic, no high blood pressure. But if you have 16 above, if you have 60 and you have a little bit of, diabetes and blood pressure, they have to do another more work upon you. So this is not enough. And then kidney disease less than 60 and kidney failure 15 and below. This is the start that your family doctor or refer you to renal doctor and assess you for more and possible dialysis because that's already low. So your filtration is not good anymore. So you need that one. So your main problem here will be fluid overload. You can go arrhythmia. So that has to be attended by the family doctor, but you have to see your family doctor. Okay, what are the things you can do so that you avoid having problems with this? The earlier the better you discover, or the earlier the better that you will be checked. This diabetic nephropathy, kidney function complication will be actually reversed. So these are the things that we should do. First, we have, oh, by the way, I'm sorry. There's another indicator so for kidney function. We have the creatinine and the urea. This creatinine and urea are waste products. So creatinine is from the creatine, from muscle breakdown, and the urea is from the breakdown of our protein metabolism, from ammonia to urea. Supposed to be, these are to be discarded by the kidneys. But because they're not working, because their kidney function is good, they will be revealing on the blood works. Okay, so what are the things we should do to reverse to keep ourselves healthy, or maybe as early as possible, we will be able to reverse the problem. So these are the things that we should do. Check your blood for GFR and creatinine. Okay, so you know the level of your kidney function. Next, hemoglobin A1C. If you're having a little bit of sugar problem, it's better that they have this one so they can see the average of 3 months of your blood sugar, lipids, your bad cholesterol. That has to be checked, and your blood pressure. You might be a smoker or not, or something in the family. So all these things have to be checked so that we will be able to check our kidneys as early as possible. Okay? Those are the things that we should do. Okay. So my next topic will be dialysis. So this is all for now. And if you think you like my presentation, you can press like and subscribe. Again, thank you.